What if the medical tests your doctor orders to keep you healthy are actually making you sicker? I'm about to share something that will shock you. After reviewing hundreds of medical studies and analyzing data from thousands of patient cases, I've discovered that 5 common medical tests given to seniors cause more harm than good. Here's what the medical establishment doesn't want you to know. One of these tests alone causes 5% of all cancer cases in America. That's equal to the cancer risk from drinking alcohol daily. Another test has a false alarm rate of 40%. The third one leads to unnecessary surgery in 12% of patients who receive it. The most disturbing part? 99% of seniors have no idea they're being over-tested. They trust their doctors completely. They show up for every appointment. They follow every recommendation. And they're slowly being harmed by the very system designed to protect them. Research shows that 37% of medical tests in people over 70 lead to unnecessary treatments, dangerous complications, or procedures that make you sicker than when you started. Today, I'm going to reveal the 5 tests you should question after age 70. I'll show you the science behind why these tests can be dangerous. I'll share real case studies that will open your eyes. And I'll give you safer alternatives that actually work. If you want to protect yourself or someone you love from unnecessary medical harm, smash that like button in the next 5 seconds. This tells YouTube to show this life-saving information to more people who desperately need it. And hit subscribe because I share health truths like this every week that you won't hear anywhere else. Test number 5. Bone density scans. Let's start with bone density scans, also called DEXA scans. These tests measure how strong your bones are. They're designed to detect osteoporosis and prevent fractures. Sounds reasonable, right? Here's the problem. After age 70, everyone's bones get thinner. It's as natural as gray hair or wrinkles. The scan will almost always show some bone loss. And once that happens, you're likely to be prescribed powerful medications called bisphosphonates. Research on over 1,200 women over 70 who took these medications showed shocking results. After 5 years of treatment, fracture risk decreased by only 0.3%. That's 0.3%. Meanwhile, these women experienced serious side effects including jawbone death, esophageal irritation, and unusual fracture patterns. Consider Margaret, a 74-year-old who came for help after her DEXA scan showed mild bone loss. Her doctor immediately started her on alendronate. Within 3 months, she developed severe acid reflux and jaw pain. She couldn't eat properly. She lost 15 pounds. She was miserable. When Margaret stopped the medication and focused on what actually prevents fractures, everything changed. Strength training, balance exercises, adequate vitamin D, and calcium-rich foods like sardines and leafy greens made the difference. 1 year later, Margaret was stronger than ever. She hadn't had a single fracture, and she felt amazing. A 2022 study in Osteoporosis International showed that lifestyle interventions reduce fracture risk by over 20%. That's 67 times more effective than the medication. Wait, before I tell you about test number 4, let me show you something that will blow your mind about test number 5. The same drug companies that make bone medications also fund the research that determines when you need them. Coincidence? I think not. Pause the video right now and comment "bone" if you've ever had a DEXA scan, or "never" if you haven't. I'll personally reply to the first 50 comments with specific advice for your situation. Test number 4. Brain MRI for memory concerns. When seniors start forgetting names or misplacing keys, panic sets in. The fear of dementia is overwhelming. So doctors often order brain MRIs to rule out serious problems. Here's what happens next. The MRI shows white matter changes or slight brain shrinkage. These findings are completely normal in aging brains. They're like finding wrinkles on your face. They don't mean you're sick. Studies of over 3,000 MRI scans in patients aged 70 to 85 with mild memory concerns revealed that 86% showed some brain abnormality. Only 3% of those findings represented treatable conditions. That means 97% of people received scary news about normal aging changes. Worse yet, 12% of these patients were sent for invasive procedures like spinal taps or brain biopsies based on these meaningless findings. Hold on, I need to tell you something about brain scans that even most doctors don't know. The radiologist reading your MRI gets paid more for finding abnormalities than for normal results. Think about that incentive structure. Consider Robert, a 76-year-old retired teacher. He was sharp and articulate. He occasionally forgot where he put his reading glasses. His family doctor ordered an MRI test that showed white matter spots. Robert became convinced he had dementia. He stopped reading. He stopped socializing. His anxiety skyrocketed. When Robert was evaluated using simple cognitive tests, his scores were completely normal. Those MRI findings were age-appropriate changes that would never cause him problems. After optimizing his sleep, managing his stress, and keeping his brain active, Robert was back to his old self within 6 months. The truth is this: unless you have severe symptoms like seizures, sudden personality changes, or rapid functional decline, an MRI rarely helps with mild memory concerns. A simple cognitive screening test is safer, cheaper, and more informative. In exactly 90 seconds, I'll reveal why the heart test that millions of seniors get every year has a 40% false alarm rate, and how it sent a healthy 78-year-old man to the hospital for 8 days. Test number 3: cardiac stress tests. Most cardiologists will hate me for saying this, and some of you might disagree, but here's the truth about stress tests. Cardiac stress tests are incredibly common in seniors. If you mention fatigue, chest tightness, or just not feeling like you used to, you'll likely be sent for one of these tests. The stress test monitors your heart while you walk on a treadmill or receive medication that simulates exercise. It's supposed to detect blocked arteries. The problem is accuracy. In adults over 70, stress tests give false alarms 40% of the time. These false positives lead to follow-up procedures like cardiac catheterizations and unnecessary stent placements. A major 2017 study in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who received no benefit from the procedure. Consider Thomas's story. He was a 78-year-old who walked 3 miles every day. During a routine checkup, he mentioned feeling slightly more tired on hills. His doctor ordered a stress test just to be safe. The results were unclear, so Thomas was sent for a cardiac catheterization. They found mild narrowing in one artery and placed a stent. That night, Thomas had a severe reaction to the contrast dye. His kidneys were damaged. He spent 8 days in the hospital. His fatigue never improved because it wasn't a heart problem to begin with. He simply needed better hydration and more rest between activities. Research shows that these procedures don't improve survival or quality of life in patients without clear cardiac symptoms. They do increase the risk of bleeding, kidney injury, and prolonged hospital stays. If you're over 70 and not experiencing classic heart symptoms like chest pain during activity or severe shortness of breath, a stress test may cause more problems than it solves. A resting EKG or coronary calcium scan provides safer alternatives. Here's what I want you to do. Think of someone over 70 in your life right now. Comment their first name below. This information could literally save their life, and I want to make sure you remember to share this with them. Stop. If you're thinking colonoscopies are always safe, what I'm about to share will change your mind forever. A 74-year-old grandmother almost died from what doctors call routine screening. Test number 2, colonoscopy. This is going to be controversial, and your doctor might even argue with you about this, but colonoscopies after 75 are often more dangerous than helpful. Colonoscopy screening is deeply ingrained in our medical culture. Everyone knows they should get one. The problem is that after age 70, and especially after 75, the risks often outweigh the benefits. The preparation involves powerful laxatives that can cause dehydration and kidney problems in older adults. The sedation poses risks to brain function. The procedure itself can cause bleeding, bowel perforation, or heart rhythm problems. Data from 1.3 million Medicare patients aged 70 and older reveals a shocking truth. For every 1,000 colonoscopies performed in patients over 75, only 2 lives were saved. Meanwhile, over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Even when polyps are found, many are small and slow-growing. Removing them in an older adult sometimes causes more harm than leaving them alone. Sarah was a 74-year-old grandmother who ran a successful catering business. She had no symptoms, no family history of colon cancer, and had already had 2 normal colonoscopies. Her new doctor insisted she needed another one. During the procedure, a small polyp was removed. That evening, Sarah developed severe abdominal pain and collapsed. At the emergency room, they discovered a bowel perforation. She required emergency surgery and spent 12 days in the hospital. She lost 18 pounds and never fully recovered her energy. The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at age 75 for most people. For those in excellent health, a simple stool test called FIT provides a safer alternative. It requires no preparation, no sedation, and still catches most concerning cases. Right now, think of the oldest person in your family. Text them this video link before you watch another second. I'm serious. Their life could depend on having this information before their next doctor's appointment. This next part is so important. I need you to pause the video and grab a pen. What I'm about to tell you about the #1 most dangerous test could save your life. Test number 1, full-body CT scans. The most dangerous test on my list is the full-body CT scan. These are often marketed as comprehensive health screenings or executive physicals. They promise to catch cancer early and give you peace of mind. The reality is terrifying. Each full-body CT scan exposes you to radiation equivalent to 500 chest X-rays. According to a 2023 study in JAMA Internal Medicine, the rise in CT scanning may now cause 5% of all cancers in America. That puts CT scans on par with alcohol as a cancer-causing factor. These scans detect countless harmless findings that are simply part of normal aging. Tiny nodules, calcifications, and cysts that would never cause problems. Once seen, they trigger a cascade of follow-up tests, biopsies, and procedures. Consider David, an 81-year-old martial arts instructor who underwent an executive health screening. His full-body scan showed a 3-millimeter lung nodule. This triggered a PET scan, then a needle biopsy. The biopsy collapsed part of his lung, requiring hospitalization and a 2-month recovery. The nodule was completely benign. The American College of Radiology is clear. There's no proven benefit to full-body CT screening in healthy adults. The potential for harm is significant. If you have specific symptoms, like unexplained weight loss or coughing up blood, targeted imaging makes sense. Scanning your entire body without symptoms is like playing Russian roulette with radiation. Key takeaway. Here's what you need to remember. Your health is not determined by test results. It's determined by how you feel, how you function, and how you live your life. The best prevention doesn't come from a scanner or a blood test. It comes from eating real food, moving your body, managing stress, and getting quality sleep. These simple actions prevent more disease than any medical test ever invented. Before you agree to any test, ask 3 questions. What will you do if the test is positive? What will you do if it's negative? How will this test change my treatment or my life? If the answers aren't clear, or if the risks outweigh the benefits, it's okay to say no. You have the right to make informed decisions about your own body. Sometimes the best medicine is no medicine at all. Sometimes the wisest choice is to trust your body's natural wisdom and focus on the fundamentals of healthy living. Before I finish, I need to know, which of these 5 tests shocked you the most? Comment the number 1, 2, 3, 4, or 5. If we get 1,000 comments, I'll create a follow-up video with the safer alternatives for whichever test gets the most votes. Your health is your most precious asset. Guard it wisely. Choose your tests carefully. And remember that you have more control over your well-being than any doctor or test result. Here's exactly what I need you to do in the next 60 seconds. First, hit subscribe and the bell icon so you're protected with information like this that could save your life. Second, share this video in your family group chat right now. Don't wait until later. Do it now while you're thinking about it. Third, comment shared below so I know you took action to protect someone you love. I'll see you in the next video where we'll uncover more health truths that could change your life forever. Until then, stay strong, stay informed, and remember, sometimes the best medicine is no medicine at all.